wondering if you might be pregnant, whether you're trying to conceive or you are just curious? In today's video, we're going to uncover the most common early symptoms of pregnancy every woman should know. Without talking too much, let's dive into the meat of today's video. Hello and welcome back. Like I said earlier on, I'm going to be sharing with you some common early pregnancy symptoms every woman should be aware of, so that we can decide if we should start celebrating or taking about the next step to take. The first sign we're talking about is implantation bleeding, and this bleeding usually happens between the 6th and the 12th day after ovulation, when the fertilized egg has attached to the uterine lining. And this bleeding is quite different from your period. It's totally different from the menstrual bleeding. It occurs when this fertilized egg travels from it moves from the ovaries into the fallopian tube and then into the uterus. On getting to the uterus, it attaches itself to the walls of the uterus, and in trying to attach itself, it disrupts some blood vessels that are lining the wall of the uterus, and this results in leakage of small amounts of blood that you usually see. This blood is the implantation bleed. So let's talk about the characteristics of an implantation bleed, how you can differentiate it from your menstrual period. So usually, let's start with the timing. It occurs 6 to 12 days after your ovulation, and this timing is different from when you see your period. The next is the color. The color of an implantation bleed is pinky, is lighter than your period blood, and then the amount is usually scanty. It's not as heavy as your period, where you have to use 2 pads a day. For these, you can just see spots of blood on your panties or on your pants liner. And then lastly is the duration of an implantation bleed. It usually lasts for about 2 to 3 days, which is shorter than the typical period would last. The next is implantation cramp. This cramp is a bit similar to the menstrual cramp, but it is also different. Different in the sense that it is less painful and it's not as severe as the menstrual cramp, and it occurs as a result of irritation of the uterine lining due to escape of blood during the attachment of the fertilized egg to the uterine walls. Now, this causes the womb or the uterus to contract. As the blood tries to escape, it causes contraction of the uterus. It is this contraction that causes the pain that is felt during implantation. This implantation cramps is very mild. It is nothing to be compared to menstrual cramp. The next symptom is nausea with or without vomiting, what we usually call the morning sickness. This is one symptom most people associate with early pregnancy. Once we see a lady of reproductive age throwing up in the morning, the first thing that comes to mind is, oh, she might be pregnant. It might not be everywhere, but in our locality in Nigeria, that is what comes to mind firstly. And then the thing with nausea is that it is not peculiar to happening just only in the mornings. It can strike at any time of the day. Now, the nausea and vomiting that occurs early in pregnancy is as a result of an increase in pregnancy hormone known as the human chorionic gonadotropin hormone, as well as increase in estrogen. Now, if you're dealing with nausea or vomiting at the early stage of your pregnancy, you can overcome this by eating little meals but frequently. You eat frequently, but you eat in little portions, and also a bit of cracker biscuit can come in handy, or you use vitamin B as well as ginger, but do not take any of these without consulting your doctor first. The next is frequent urination. If you find yourself running often, very often to the toilet, you might just be pregnant. Yes, and this occurs very early in pregnancy because there is increase of blood flow to the kidneys, and so the kidneys filters a lot of fluid which comes out as urine. Also, the uterus is between the bladder, and the rectum. Now, as the baby grows, it compresses the bladder, and this causes frequent urination. And this might actually be very inconvenient, but this does not mean that you should stop taking water. So the more you frequent your bathroom, the more you should take water to actually get hydrated for you and the baby. The next is breast tenderness and fullness. So for some women, they experience breast tenderness, that is, their breasts become painful, fuller, and even breast soreness. All of these is just your body preparing for breastfeeding. Also, hormonal shifts can also cause increased blood flow to the breast tissue, resulting in all of these symptoms. For some women, the areola becomes more darker or more pronounced than it's supposed to be. All of these are normal and it should not be a cause for worry, especially if this is your first pregnancy. The next is a missed period. Now, this sign is the most noticeable sign of early pregnancy. For some women, they are not even aware they are pregnant until they have a missed period. This is the first clue that tells them, oh, something might be happening. Now, if you experience a missed period with all the symptoms I've mentioned before, or with some of those symptoms, you should take a pregnancy test at home. A missed period doesn't always necessarily mean that you are pregnant, although yes, it is the most noticeable sign of pregnancy, but sometimes you might not be pregnant. If you are experiencing a delay or a missed period and you have taken a pregnancy test and it is negative, there's a video I made on causes of delayed period. I'm going to be putting the link so you can just click on it and watch it to know why your period is being delayed. The next is fatigue, what is also known as tiredness. So if you feel unusually tired even after getting adequate good night's sleep or adequate rest and you're still feeling unusually tired, you might just be pregnant. And this is because of increase in the hormone level called progesterone, which makes you feel sleepy and sluggish. The next is mood swing. Some women experience mood swing. They become very emotional, some become very irritable, some become easily very angered. All of these is because of the body's way of trying to adapt to the rapid hormonal changes that is occurring. Nothing is actually wrong with you. You are doing just fine. The next is rapid body temperature. For some people, when they get pregnant and it's still early, they start to feel feverish and then they think it's malaria. So they want to quickly go and do a malaria test and then all of that. Yes, it might be malaria, but it might not be malaria. It might just be malaria, meaning you're pregnant. So instead of getting anti-malaria, you should start preparing for antenatal. Right. You see what I did there? The last but not the least is changes in your appetite. For some women, they experience change in appetite, a new craving, or food aversion. You see that the food you usually love to eat, you no longer want to eat it. Or some women, they want to do a new combination, such as, oh, I want okra and moi moi together. Weird, but that is what the body wants at that point. And all of this is not because something is wrong with you, it's because of hormonal changes that affect your smell and taste. If you're experiencing change in appetite, food aversion, or cravings, you should eat what makes you feel comfortable. However, you have to eat healthy for yourself and for the baby. In conclusion, every pregnancy journey is unique and not everyone will actually have all the symptoms that I have mentioned. If you think you're pregnant, the best step to take is to get tested and consult your doctor today. Thank you so much for watching. If you found this video very helpful, don't forget to give this video a thumbs up, share it to your friend who you think might need this information, and subscribe to my YouTube channel for more informative content. Thank you so much and see you in my next video. So before we go, guys, I would love you to drop on the comment section below what early pregnancy symptoms surprised you the most. I would love to share your experience. Thank you very much.